We're joined now by Texas Division of Emergency Management Chief Nim Kidd. Chief Kidd, thank you for joining us. Earlier this week, you said that the state is in good shape when it comes to personal protective equipment. Now with the surge of new cases, is that still the case?
Yes, ma'am, it is. So far we have bought and distributed about 74 million masks across the state into our healthcare workers and first responders. We have an additional 43 million in inventory right now, and that doesn't count the almost 49 million that our federal partners have put back into the regular supply chain.
Okay, now I have a two-part question for you. So today Governor Abbott issued an executive order expanding hospital capacity. Is the Texas Division of Emergency Management prepared if there becomes a shortage of hospital beds? And my second part is there a plan in place for temporary hospitals to take on overflow?
So the answer is yes and yes. So yes, we are prepared, working with our local partners, which includes our private sector partners like the hospitals, to ensure bed capacity is out there. There's still over 12,000 available beds in Texas today, and frankly, only 3% of the hospital beds in your viewing area are taken up by COVID patients today. So statewide, that average is about 10%, but just in your area, you're at about 3%. So 3 out of every people in your hospitals right now are there because of COVID.
Okay, now we're starting to see local governments implementing mandates across the state regarding requiring masks in public places. What do you think about a statewide mandate?
So I think we are not a one-size-fits-all state, and just to the point that we made, about 3% of the patients in your hospitals have COVID-19, where in other parts of the state it's up to 13 or 15%. So we've seen that statewide, one-size-fits-all approaches really aren't best for the overall health of our community. And so we really want to work together with our partners to make sure that we're doing the right decisions at the right time for the right places in Texas.
Okay, and so are there any safety protocols that you plan to enforce for businesses and employees across the state? For example, requiring testing for employees who decide to return to work?
So I can say we absolutely want to continue to reinforce safe practices, and we're increasing enforcement. I think you've seen the Texas Alcoholic Beverage Commission in several places across the state has already suspended liquor licenses for bars that are not following the rules. We want to make sure that we get to reopen business, but we've got to do it safely, and we've got to do it in partnership with the public. And that includes not going out if you don't have to be out. It includes covering your face, your nose, and your mouth when you're out in public, and trying to stay more than 6 feet away from each other, washing your hands as often as you can, and being very cautious and cognizant of those high-touch places when you're in the public.
And we know Brazos County has a spike in cases by more than 100 cases in just one day. Is this because there's more testing going on? Is this community spread? What can you tell us about that?
Yeah, I think it's all of the above. I think there are more cases going on, but part of the reason we know there are more cases is because we're doing more testing. I mean, there is an age demographic that's been studied in the medical journals that 1 in 5 of them only has signs and symptoms even after testing positive. So what that means is our younger community is positive or can be positive for COVID-19 without having fever or a cough or any of the signs and symptoms. And even though they don't exhibit those signs and symptoms, they can still spread the disease. That's why it's so important that we follow those very basic hygiene requirements that we're talking about keeping your hands washed, about covering your mouth or covering your nose, and not being in large crowds. It's very important that we corral this virus by not being in large crowds together if we don't have to be.
Now we know Governor Abbott is actually pausing or choosing to take a pause on reopening the state further. So do you foresee any more quarantining going on, another shutdown or anything like that?
I think it's important that we watch the numbers every day, and Governor Abbott is always studying the numbers, and several times a day we're having conversations about all of the parts of Texas. I mean, all 254 counties are on his radar right now. And the important thing is that we're wanting to work just in the areas where we keep seeing this rapid growth and allow those areas that are doing things right and everybody's following the rules to reopen as gradually as they can. Now, there is a pause right now, but there are many places that are open for business, and as long as we can keep the numbers down, those places will stay open.
And my last question here, what would be your message to small business owners and medical professionals here in Texas?
Well, first to the small business owners, thank you for the business and the work that you do. You're the backbone of our society, and we really want to make sure that you and your families are safe and that you provide a safe place for your patrons to come in. But more importantly than that, for the healthcare workers and the first responders that are out there, we owe them a gratitude that we can't afford to pay. I mean, they're out there on the front lines taking care of us every day. So if you want to thank the healthcare workers, do that by taking care of yourself and stopping the spread of the virus, making sure that you're following the rules that we've put out there about social distancing and covering your mouth so that we can slow the spread of this thing.
All right, well, thank you, Chief Kidd, for taking some time out to speak with us today.
Thank you very much.